Sullivan, Deputy Connolly.
As has been pointed out, this bill comes before the Dáil, consequent on the recent series of murders in Dublin's North Inner City, and indeed the Minister for Health confirmed in the Seanad on the 15th of June that the bill had been expedited in response to those murders, and because the Government and the Garda Síochána were both of the view that controlling these products under the misuse of drugs legislation would lead to more effective enforcement. In fact, it appears that this was the one tool that the Garda had asked specifically for. Now, while I fully appreciate the seriousness of the situation in Dublin's North Inner City, and I acknowledge the actions taken by the Government, I am not convinced, and indeed have serious concerns, that this bill is the most effective way to deal with the situation, and my doubts are further heightened, firstly by the failure to include the promised provisions for supervised injecting facilities. These provisions would have enabled the Minister for Health to issue licences permitting the establishment of supervised injection facilities, to provide enhanced clinical support and to mitigate the problem of public injecting by chronic drug users. These provisions have now unfortunately been kicked down the road. Secondly, and most importantly, there is absolutely no recognition or no urgency to the recognition by the Government that continuing down the road of criminalising the use of drugs is not actually working, and that other countries have recognised this and taken a different approach and are in the process of taking a different approach. Put simply, the war on drugs has not worked, and certainly has not worked for those who are criminalised by the use of drugs. And just in relation to that, the European Drug Report in 2016 said that the majority of reported drug law offences relate to the use of possession. For use, not to the sale of drugs. And in Europe overall, it is estimated that more than 1 million of these offences were reported in 2014. That's an increase of 24% compared with 2006. And of the reported drug offences, more than 3/4 involved cannabis. So we have a huge amount of resources, Garda resources, going in to charging people with the use of drugs, and very little success rate in the conviction of drug dealers. And if we go back to the alternative ways of dealing with this, Portugal, a small country like Ireland, recognised in the 1990s that the drug problem had become one of the main concerns for the public, as had the significant increase in the numbers of people infected with HIV and AIDS and other associated illnesses. My knowledge about Portugal, Minister, comes from an Oireachtas report, a joint committee on justice, defence and equality whose members visited Lisbon and studied the situation there. That report acknowledges that drug abuse was not confined to any particular social class, but it was a universal problem. It also noted that not all addicts were using illicit drugs, but were in some cases addicted to prescription drugs. To criminalise rather than treat this group of people was viewed as wrong. The first step that they did in Portugal was to remove responsibility for this matter from the Justice Department and reassign it to the Health Department. It was also noted that while it was still an offence to take or possess drugs, the offence is now treated in a similar way to traffic offences. And this provision applies only to possession of a quantity of up to 10 days' supply for personal use. That's the formula that they use. And any person found in possession of drugs must report within 72 hours to a commission for addiction dissuasion for a treatment programme tailored to the individual's needs in order to ensure the best possible result. That report, Minister, is well worth reading because it mentions quite a number of things highlighted by the Joint Oireachtas Committee in Portugal. One of those, the advantages of having no criminal record. This is an important component of that approach adopted in Portugal. The purpose of the provision is to allow the person the opportunity of a second chance at turning their life around. They mention education and the importance of education at every level. They mention the importance of breaking the cycle. And in this regard, they highlight how drug addicts had the opportunity to move away from a life of drugs by the use of positive discrimination for gaining employment. This system offered employers a tax break to employ recovering addicts, and the state then jumped in to pay the addict's salary. The employer, however, was required to release the employee for their treatment and counselling until their programme had concluded. The delegation was told that in many cases these employees gained full-time employment and did not go back to the use of drugs. That's just one example. Deputy Wallace has mentioned other examples, and that's one that this Oireachtas looked at, and perhaps they didn't agree with it, but they certainly thought it was well worth looking at. In relation to the outcome in Portugal, I think it's worth pointing out, the approach in relation to drugs has not resulted in Portugal in an increase in drug taking, nor has it resulted in Portugal becoming a destination for drug tourists. And it sets out what their fears were 15 years before this was adopted, and 15 years after, 15 when it was passed, and 15 years later. At the same time, it says drug consumers are no longer looked upon or treated as criminals, not only by the authorities but also by society. They became less dependent on traffickers and police discretion, and the end of thousands of criminal cases for drug consumption, which is very important in terms of Garda resources. The end of thousands of criminal cases for drug consumption that cost time and money with absolutely no gain. Closer to home, we have the report of the Royal Society for Public Health Vision, Voice and Practice in England with the title Taking a New Line on Drugs. And they say we need a new people-centred approach to drug policy, rooted in public health and the best available evidence. The time for reframing the global approach to illicit drugs is long overdue, and the imbalance between criminal justice and health approaches to illicit drugs is counterproductive. This is a UK report at the highest level, published only in the last month or two. The report assessed the situation in the UK as regards rising health harm from illegal drugs, with reference to their context, and this is particularly important given that we were all at a briefing on the alcohol bill today, with reference to their context within the wider drugscape of legal drugs such as tobacco and alcohol, and it sets out a new vision for a holistic public health-led approach to drugs policy at a UK-wide level. At point 4 of the executive summary, for example, it sets out that at both individual and population level, alcohol and tobacco cause far greater harm to health and well-being than many of their illegal counterparts. Tobacco kills the most people, and alcohol is not far behind, with death rates from alcohol misuse on the rise. Alcohol and tobacco use alone cost society more than all Class A drugs combined. 8.8. Decriminalising personal use and possession of all illegal drugs and diverting those whose use is problematic into appropriate treatment centres. I'm going to finish, Minister, by asking you to look at these reports, look at international evidence and best practice, and let that determine the next strategy and the next piece of legislation that comes before this stall, so that we can all work together and tackle a problem that will not be tackled by criminalising drug users.